Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, this afternoon is my task in sharing with you the HEOC situation report for today, Wednesday, January the 27th. Now, in St. Kitts and Nevis, we have reported a total of 37 confirmed cases of COVID-19. We recently disseminated a media release, I think it came out last evening, announcing 2 additional imported cases of international travelers into the Federation who were found to be COVID positive. So to date, 25 have been reported from the island of St. Kitts and 12 from the island of Nevis. Between January 20, based on the World Health Organization's COVID-19 dashboard, a total of 99,864,391 confirmed cases have been noted, and in terms of the death toll is over 2.1 million to date. Between January 2020 and present, over 25 million persons have been confirmed with COVID-19 in the United States of America, and the death toll is over or stands at more than 439,463 in the United States of America. Yesterday, the death toll crossed the 100,000 mark in the United Kingdom. As you are aware, there is a variant of the SARS-CoV-2 virus that was identified in the United Kingdom, and it has been responsible for a surge in the number of cases and deaths in the UK. In the Caribbean region, over 439,000 persons have been confirmed as having COVID-19, and over 6,443 persons have died to date. What's happening in our neighboring islands? It's interesting to note that Barbados at present is experiencing a surge in the number of COVID-19 cases. Within the past 2 weeks, they have confirmed over 509 persons. To date, they have over 1,401 confirmed cases of COVID-19 in Barbados. There have been 10 deaths in Barbados to date from COVID-19. In terms of St. Lucia is also experiencing a surge. The total number of cases over 921, with approximately 448 cases diagnosed within the last 2 weeks. There have been 13 deaths confirmed in St. Lucia to date. St. Vincent and the Grenadines also experiencing a surge in cases, with a total of over 763 confirmed cases. Again, within the past 2 weeks, they've had over 497 confirmed cases in St. Vincent and the Grenadines. And in terms of St. Kitts and Nevis, to date we've tested over 7,543 persons, and as I said before, 37 who are found to be positive. So we have a very low positivity rate of 0.5%. This afternoon, another batch of students from the Ross University School of Veterinary Medicine were repatriated. Approximately 132 students came in on the charter from Miami, and approximately 15 students came in on the charter from Puerto Rico. They are in quarantine at the bulk or majority of the students are in quarantine on the dorms at the RUSVM on the campus there, and about 25 or so students are in quarantine at the Koi Resort. So at present, we have a number of persons in quarantine or vacation and in place, about 257. We have 2 active cases, and so these persons are in isolation. So at present, we have 37 confirmed cases. 35 of our cases have fully recovered, 0 deaths, and so we only have 2 active cases. Okay, so at present, the scientists are monitoring the emergence of some 3 or more SARS-CoV-2 variants of public health concern. One variant, or the main one, has been identified in the United Kingdom. Another variant was identified in South Africa, and another variant identified in Brazil. Now, the scientists are conducting studies, and to date, they have found that the variant identified in the United Kingdom is estimated to be more transmissible. So in other words, if you contract the disease caused by this variant, this UK variant, the risk of you transmitting this virus to a number of persons is increased. There's an increased risk of transmitting it to 3, 4, 5 or more persons. And then based on the studies so far, there is realistic possibility that infection with this UK variant is also associated with an increased risk of death compared to infection with a non-variant virus. All right, so it's important to note that this variant is more transmissible, and it's now associated with more severe COVID-19 disease. And so probably that's why you are seeing a surge in the number of cases and deaths in the United Kingdom. It's important to also note that this variant has been identified in innumerable countries across the globe, well over 60 such countries. And some of these are in the Caribbean region. And so to date, Jamaica, St. Lucia, and Barbados have identified cases as a result of the SARS-CoV-2 UK variant. So it's important to note that this variant is already in the Caribbean region, and so it follows that the risk of our importing this variant is high. Okay, so what's happening in terms of the COVID-19 vaccines? Well, let me just begin this section by saying that the vaccines still bring hope. From where I stand, it's still, the vaccines bring hope. And I'm happy that on the market, we have 3 main COVID-19 vaccine candidates which have received regulatory approvals in the United Kingdom and the United States of America, and even further afield in the European Union. And so the 3 leading vaccine candidates are the Pfizer-BioNTech vaccine, and then 2, you have the Moderna vaccine, and then thirdly, you have the AstraZeneca and Oxford vaccine. However, there are 7 other vaccines that have received emergency authorization in some other countries outside of those that I would have just mentioned. And these vaccines are also under review, meaning the dossiers of these vaccines, the dossiers from the clinical trials involving these vaccines are also under review by the World Health Organization. So to date, the World Health Organization has only approved the Pfizer-BioNTech, but they are reviewing the dossiers of the other vaccines. So hopefully WHO approvals for the others will be, coming soon. Now, please note that access to the COVID-19 vaccines is crucial to curbing the spread of COVID-19 infections and restarting economies in the region and globally. But it's also important to note, if you follow what's happening in the news in terms of BBC, CNN, it's obvious that the demand for the vaccine far outstrips the supply, and so there are challenges. But it's reassuring to note that the Federation of St. Kitts and Nevis has signed on to the COVAX facility, which gives us, we've signed on to this facility and we've paid our down payment, and this process gives us access to enough vaccines that covers at least 20% of our population. And also the Republic of China, Taiwan would have given us in the form of a donation $600,000 for the procurement of vaccines. And over the last few days, CARICOM was offered 1.5 million vaccines through the AMSP platform. And of the 1.5 million vaccines donated to, or pledged to, or committed to CARICOM, 9,439 vaccines are allotted to St. Kitts and Nevis. So in other words, we will have access, the Federation at present has access to COVID-19 vaccines through two modalities or facilities. And it is expected that COVID-19 vaccines will be made available to Caribbean member states within the second quarter of 2021. At present, we do not have a specific date, but we are making sure that we are in a state of readiness for such vaccines when they become available for distribution to CARICOM member states. I want to pause and speak to all of us. Now, our numbers in terms of COVID-19 continue to increase gradually, and as I would have mentioned earlier, we do have cases of the UK variants, SARS-CoV-2 or COVID-19 UK variant present in the Caribbean region in at least 3 territories. And with regional travel, the risk of our importing the UK variant is high. And so I implore us all to continue boosting our own immune system just to make sure if perchance we are exposed to it, we can remain without symptoms or fight off the infection. So it's important that we pay attention and boost our own immune system. It's even more important now for us to adhere to the COVID-19 prevention and control measures, because the variant, if perchance it arrives here, the risk of more persons being impacted is high, and the risk of more significant disease is also high. And so I can only quote the old adage, prevention is better than cure. Please, can we always wear our face mask when in public places? And let's not take it for granted. So when in our offices, when speaking, even at home, our loved ones, persons we are familiar with, we relax and we take off the face mask. Please make sure you keep your face mask on when in public places, spaces, and with groups of persons. Always maintain good hand hygiene. Always try and maintain adequate distance between yourselves and others, because then you reduce your risk of exposure to the virus. And crowds, sporting events where many persons are gathered. It's at this point in time, it's advisable that we avoid such. And so these measures are even more important now, given our present context. Our numbers here in the Federation are climbing slowly, and the variants, the UK variant is already in the Caribbean region. We are not sure if it's here as yet, so we need to adhere to these measures. And there's yet another factor. We are in the middle of the influenza season, and a number of persons throughout all age groups seem to be impacted by the flu, the regular flu, whereby you have runny nose, stuffiness, coughing, sneezing, headaches, etc. And it's very important, if you are experiencing symptoms of the regular influenza, we ask you to remain at home, do not go to work. And if your child is impacted and is experiencing any of these flu-like symptoms, please keep your child at home. And make contact with your primary physician, make a call, and share what you're experiencing, and you will be directed as to how you can receive the relevant medical care. Please note that wearing the face mask, hand hygiene, and physical distance also prevents you from picking up the regular influenza.